can be difficult to access behavioral health care. Milliman reported that roughly 2/3 of Americans with a diagnosed mental health condition were unable to access treatment in 2021, though they had health insurance. And only 1/3 of insured people who visited an emergency department or hospital during a mental health crisis received follow-up care within a month of being discharged. Well, Washington State is among the states with the highest levels of unmet mental health care needs. But a program at Providence, Swedish aims to help close some of these gaps, and licensed clinical social worker Kelsey Smith joins me. Welcome.
Thank you.
You listen to that and you have a whoa moment.
Definitely.
That it shouldn't be this difficult to get care, but I know it is. You have two programs, outpatient and then partial hospitalization. Let's talk first about the intensive outpatient. What does that involve?
Definitely. So our intensive outpatient program, it's a day program that's about 3-4 hours a day, several days a week. So this is for individuals that are struggling with anxiety, depression, mental health symptoms that are impacting their day-to-day functioning, and they may feel they need something more than individual therapy or medication management.
Okay.
So they come to the intensive outpatient program. We do a variety of groups. So some are psychoeducational, some are process groups, and then they can also see an individual licensed clinician during their stay as well. They're with other patients that have similar struggles, so it's a great opportunity for them to connect and share in some of those similar struggles, develop coping skills to help manage their stress and depression, and then they go home each day and they're able to apply the skills that they've learned, then come in the following day and process how that went.
And you have something now called partial hospitalization, which is really an interesting concept because we've only heard of you do some outpatient therapy or you have to go in and be hospitalized in that sense. But tell me about partial hospitalization.
Yeah, so that's our next step up. And I forgot to mention with intensive outpatient, we just started at Edmonds this past Monday, and then Ballard it's starting this Monday. So it's a very new program. The partial programs we've had a little bit longer for both locations. So that's going to be that next step up where maybe your symptoms are more severe, your anxiety, your depression, it's making it difficult to get out of bed, be able to go to work, function in your family or in your community. And so these programs, especially this one, helps with applying additional coping skills. There's going to be medication management consistently in this program as well. So if
you stay overnight though sometimes? Or?
Not for this one, no. So you still are going home, but this one is about 5 to 6 hours a day, whereas the intensive outpatient program is about 3 to 4 hours a day.
And it's at the hospital facility.
Yeah.
Who's eligible for these programs?
Yeah, so it's adults 18 and older. We take most commercial and Medicare insurance plans, a couple Medicaid. It's for individuals who are, volunteering to participate in the program, so are motivated to seek care. But if someone has imminent risk to themselves or others, such as they are feeling suicidal, we're going to recommend a hospital level of care, so intensive inpatient programming. That's a 24-hour day program. So
that brings up a thought about with a loved one. You mentioned if they're suicidal, but can you offer some guidance as how we can talk to our loved ones about maybe getting them to seek help in programs like this?
Yeah, definitely. So if you are seeing your loved one struggling with something, it's really important that you're intentional in reaching out to them and saying, hey, I can tell something's going on. It looks like you're not okay. And even reflect to them the things that you're noticing, such as you're not going to work. You're sleeping in longer and longer. You're not engaging with your family and friends how you typically do. So, reflect that to them and say, it's okay to not be okay. I think there's a lot of stigma around mental health, and we've come a long way.
Yeah, we have.
But we still have a long ways to go. So,
And so along with that idea with the stigma, because that is still here, but yes, to your point, we have come a long, long way. We're talking about it, just the fact that we're talking about it, daytime television, right? But tell me more about what Providence Swedish is doing about that stigma.
Yeah, definitely. So we have a lot of partnerships in the community. One is with the Renton Mental Health, or Renton School District. And then we have the Seattle Sounders, we work with the Storm. So really just promoting advocacy around mental health, reaching out for support, knowing that people are not alone, and it's important to reduce the stigma of mental health.
And I see the one with the little girl here, just that we're talking about it, that it's okay, because for many of us, we saw relatives go through something. We didn't know what to say. They didn't want to talk about it. And it is out there more. And I appreciate that. Tell us about some other behavioral health services at Providence Swedish.
So when it comes to mental health, there are different programs, and one size does not fit all when it comes to care. And we're really passionate about that. So we have a variety of programs based on people's needs. Another program we have, I mentioned earlier, is our inpatient behavioral health program. So that is where you stay overnight in a hospital setting. We actually also have a perinatal center for bonding program. So this is a day treatment program for postpartum moms that have postpartum depression, postpartum anxiety, and they actually get to bring their babies with them. And process with other moms. Yeah, so that's one of the few in the country that we have that program, and we're really grateful to have that program.
As somebody, thank you, as somebody who had a daughter go through that, and that those programs are valuable, and also just the sheer talking about postpartum depression as well is so incredibly valuable.
Yeah.
And we should also say that this isn't always for chronic conditions, right?
Correct. So you could have chronic anxiety and depression, but it could also be you went through a major life event recently that brought on these symptoms, and it could be a negative or a positive event, such as moving, losing a job, getting married, having a baby. And so I think that's important for people to note that you may have these symptoms from something that occurred recently, and these resources are here to help.
It's good to know. Thank you so much. And to learn more, you can go to the website you see right there on your screen, swedish.org/behavioral health.
This portion of New Day Northwest is sponsored by Providence Swedish.